healthcare system at the patient level that have called for these changes. It was very clear in the last election that the patient lens needs to be applied to healthcare, and we're seeing that more and more. We saw that in Robin Martin's remarks today, and we're seeing it constantly from Christine Elliott, the Minister of Health. I think that's a great thing. So can you please tell the audience a bit about the challenges patients are facing that have led to the need for these transformative changes, and maybe Purushka, if we could start with you.
So interesting listening to these comments, because when I look at the challenges that we're facing, there is educational challenges, there is challenges with respect to access, and challenges with respect to actually what is available. So from a nursing perspective, because I worked in management as well, and how we actually were able to access resources, certain areas where certain resources were required or are required even right now, it just simply wasn't available. And certain patients had no access or little access, especially minorities, visible minorities, patients with disabilities, or those living alone with disabilities. So that's a huge issue, and we were not working as a team, or we were trying to. So this will help work together to provide more access and to provide the right services for that population from that perspective. The other one is with respect to how we are going to educate people about this. And I mean, part of my role in the RNO is educating not only nurses, but also the public, and as well as politicians. We are very active at Queen's Park about the challenges that we face at the bedside, and also our scope of practice, which is also changing because there was a request put through from the ministry to the College of Nurses of Ontario to change the scope of practice of RPNs and RNs. So all of these are challenges to implement because they will take time. But right now, being in almost like silos, the LHINs have become these silos where they followed certain rules. However, the amount of hours that someone received or the type of services that were available, each one was quite different. And I can speak to it because I taught actually in different LHINs, and I worked in different LHINs and also different parts of hospitals. So I actually saw it on the ground that this was not equal. And so now with implementing, for example, person and family-centered care, transformation, and other best practice guidelines, we're actually evening the field out. So meaning we're going to be starting from the same process and the same policies versus picking and choosing what we're going to work with. And one of the biggest things I think for access is that once these teams decide for their area what are the priorities, then that will automatically focus on that demographic and also on what the needs are for those areas. So it will hopefully address that. And that's sort of what we're seeing. It's funny, our CEO said that everybody thinks the sky is falling when the winds came, then the sky didn't fall. And now everybody thinks the sky is falling because we're changing again, and it's going to be okay real soon. But it's really important to remember that this takes time, and that's one of the challenges, and this is happening very fast. And I know people on the ground are working very, very hard. So one of the challenges is how do we educate and keep people on track so that this comes to fruition and to maturity, and also to make sure that everyone is coming together at the same time. But it's very hard to implement, like you said, how many people you have to come and pull them together in the community, from community to hospitals, clinics, family health organizations, all of them working together. It's a big job. So I think that's going to be the biggest challenge.
And Kathy, from your perspective, can you talk a bit about the patient level, the patient challenges they're facing, and then Heather and Deborah, feel free to jump in there.
Yeah, actually, it just occurred to me sitting here, so I have obviously many years of experience of dealing with the clients that we work with, but I actually have a personal example that's actually quite recent, and I think it demonstrates the challenge that families face today. So my grandmother, step-grandmother, had dementia, lived with my father and stepmother, did qualify for, at the time, the CCAC, so personal support workers going into the home, and could manage okay for a while. But when my dad and my stepmother would go away, the PSW would come to the door. She wouldn't let them in because she had dementia. She didn't understand they would leave. So she wasn't getting her medication. She wasn't eating properly, et cetera, et cetera. So eventually he gets to long-term care. And recently, over this past winter, was in the emergency department twice, so taken by ambulance, so huge resources there, taken to the emergency department, actually really needs to be in the emergency department, but the home couldn't handle her. Nursing staff were not, stretched to the limit. They can't sit with someone 24/7 in the emergency department. I stayed overnight with her while she's climbing out of bed, etc. So this is a personal example, but one that we hear every day, is that people are really, the system is really stretched, education of people, understanding how to handle people with dementia in a way that's beneficial and helpful. Now, the emergency department is not a pleasant experience for anyone, let alone someone who is having trouble understanding what's happening around them. And so, it's, and actually, interestingly, my stepmother called and said, well, she's gone to the hospital. How long can she be out of her long-term care bed before she loses it? I said, well, I actually don't know. I am the CEO of the Alzheimer Society, and I don't know. So I thought, well, how hard could it be to find out? I could not find on the internet the answer to that question. And I'm the CEO. And so if I can't find it, imagine if you are from a marginalized community, you don't speak English. This is a very foreign situation for you. So again, I think that really just highlights, in a very small way, the reality that, lots of families are facing. Solutions are there. I think all the players that are now around the OHT tables have all the answers, but it takes the coordinated communication and collaboration to solve it.
Can I just add to what Kathy's saying? I think, some of the other challenges that we're finding in health is that health doesn't stand alone. Big H health doesn't stand alone in terms of being able to encompass everything that people need in terms of their ability to stay well. Wellness is really a whole spectrum of things and includes a lot of the social determinants of health. And I think we're really getting more and more encouraged about how much health providers are starting to embrace how important that is. I don't know if everybody saw the star yesterday that UHN purchased a piece of land for supported housing. I mean, this is the kind of directions that we're going to need.
Members who are all members of the corporation and have representation at the table at the end of the day. So there are options. And again, what's most exciting about the initial phases is that in this partnership phase, in this collaborative phase, it has the advantage of groups that wouldn't necessarily be collaborating in the past, coming together and at least having the conversations and getting to know each other and surfacing some of the challenges. And that can be achieved either through informal governance arrangements or through more formalized memorandums of understanding and agreements and that sort of thing.
Right? So you talked a bit about how collaboration and bringing all these groups together can lead to really good solutions, hopefully really innovative solutions. I think one of the areas where Ontarians are looking to see a lot of progress is on technology. I think Ontarians are hoping Ontario Health teams or through Ontario Health are going to get us to the point where we can maybe book our healthcare appointments online or view our medical records. Deborah, can you talk a bit about the changes when it comes to technologies or the opportunity when it comes to technology with Ontario Health teams and maybe what you see the future of digital health being when it comes to this transformation?
So I think when we say technology, it's yes, yes, and yes. Right? we all know that in order for any of the transformation to be successful, that it has to be built on a really strong platform of technology. The challenge, I think, that in going forward, and certainly we've seen the tools the ministry's been able to put out in the digital playbook, is that not all parts are equal right now. There's real challenges in terms of data collection for different parts of the health system, which really is going to be difficult for the teams, particularly as they're moving forward, trying to get a better sense of the transition points for patients, clients throughout the system. So where we would like to build on existing systems, in some cases there are no systems to build on. We have, a number of legacy platforms that were designed for different purposes. And so as we look at OHTs, certainly this is going to be a significant area of investment, and I'm sure the vendors are going, yeah, this is great. I think, starting to look at what the parameters are going to be for health providers around technology is going to be an important start. one of the speakers, this is my little plug for our conference coming up in October, is one of the senior leaders from Kaiser Permanente, who obviously have been renowned for their work around accountable care organizations. And they have the luxury of having one entity, one system to develop off their organization. We have, I don't even know what the count is in terms of what we're looking at. So clearly technology is going to really certainly be a big thrust for everyone, and looking at what will be in an environment where we're constrained by funding, you know, what we can use and what we can't use, I think will certainly be sort of top of the heap for Ontario Health as they take on their role in health going forward.
And you hit the nail on the head. Funding is a big question mark with Ontario healthcare teams. I know that's something a lot of organizations are worried about and maybe excited about at the same time. Can you talk a bit about the maybe current funding challenges? Is the money there if we're able to restructure our system better? Are there certain areas that we need more investments, and what does that look like?
So some of the funding models actually have changed over the last probably 10 years or more when it comes to healthcare funding. So there was at one point that we switched over to what's called HBAM, and it was about measuring and actually meeting certain metrics. And then there was a reward system in place, which I can tell you didn't really work that well on the ground, but it's still in place. And it created this shift, a paradigm shift happened, and they were really hard to actually adjust to that paradigm shift, thinking differently as managers and directors and VPs around funding models. And it was very difficult to sort of change how do we measure this. Now, healthcare is one of the sectors that almost keeps the most data. We measure everything, like literally. We measure everything. So if we ever are looking for information, there's a lot of information. But sometimes a lot of information can be very confusing. We need to know what information is pertinent to what is required. And so one of the things that with the funding model is that right now we know that there's a certain amount of funding available, but it's in a mixed bag. So because it's in a mixed bag, or the teams are being all funded together, we don't know outside of that. For example, public health is not in there yet, or we're not quite sure. And public health does play a big role in the community. So we're still waiting to see how that's going to actually pan out. As well as these models are being created, or as these teams are working together, further down the road, there may be changes to the models, or they may have to do changes, and that may have to be adjusted through funding. Because if the demographics are changing, and or even the delivery service, the cost of, or the type of staff mixing or services that they need, if it changes, then there has to be an adjustment. And so there has to be a future planning around funding for those changes, especially if they're more required in long-term care, as well as some of the chronic diseases that people manage in the community. If there's enough funding in the community and public health that actually prevents clients to be in a revolving door in the ERs, so that does actually resolve the issue of early medicine. Because part of the reason is people keep coming in. We send them home because we gotta get the metrics, and then 2 days later they're back again in ER, and then we call it a revolving door. And so if we can nip that in the bud, before it gets there, then that will actually help mitigate that piece that we're not gonna have people in the hallway, which is really unsafe actually. So hopefully that will change the funding model, as well as what are we measuring. And we're not sure what we're measuring yet, because the teams are just forming, they're just figuring this out. So once they know what outcomes is desired, and how do I measure that outcome so that it's sort of a justification for what the funding was for, that still has to be outlined by the healthcare teams.
So I promised after making you talk about the challenges, we get to talk about what's exciting about this transformation. So I think I want to put it back to you guys. And we talked a little bit in our introduction that Ontario health teams are a great opportunity for organizations to start collaborating, to start working together. And I think we're seeing more than ever before different organizations coming together, partnerships between mental health organizations and hospitals and community care, seniors care, and that's a really great thing. So I'm going to put it to each of you to discuss a bit about what you're most excited about this transformation and what you hope it will lead to in terms of whether it's outcomes and deliverables or what it will look like for patients. So maybe Deborah will start from you and then work our way down.
I think just by virtue of putting a group of health providers together, you already are starting at a very advantaged position. I think that we've all wanted that opportunity to really connect with each other in terms of looking at how we could improve things for patients and people in the system. And I think the opportunity to sit down and talk about that or to structure a system behind that is really important. I think what will be very important is that we don't lose grounds on the engagement of clients in this process. And I think the last few years we've really moved the yardstick in terms of meaningful client engagement and co-design of the system. And I think the importance of making this change for individuals who use it is going to be increasingly important. And I think, the other thing I'm excited about is that we're starting to engage not just at the senior leadership level, but we're starting to engage at the mid-career level, the leaders of tomorrow. We've all come out of silos. You're a trauma nurse, I'm, nephrology, and we all have our subsectors. But the future is about an integrated system. And we're going to need leaders who are prepared to be able to lead systems coming forward. So I know our association has been very engaged in working with our mid-career and senior leaders to help them prepare to use those skills as they work with other people within the healthcare system. And I think that's going to be something that all of us who are part of the change going forward will need.
Heather, do you want to add anything to that?
That's a perfect segue actually, because one of the things that I'm excited about is that it, at this stage at least, is voluntary. And from a leadership perspective, a quote that we've been using when bringing teams together and looking at collaborative governance is true leadership exists only when people follow when they have the choice not to, right? So I think that resonates with me in terms of bringing together sort of mid-level people, maybe who are not as entrenched, right, in their silos, people who are making the choice to come together. And that is where I think the leadership is going to come from. Obviously, on a personal level, I'm really excited that there isn't a lot of prescription in terms of governance models. We can be really creative in terms of, well, like I said, the initial stages and the maturity. But something that you said reminded me that there are some parameters, of course, to governance, and one of them that I think is really important is that patients be involved in the governance model, right? In the initial stages of maturity. And there's also a mandate that physicians are involved, either in governance or at least in the leadership of the Ontario Health Team. And I find that really exciting because I think that's the right direction. And another thing that is coming in terms of guidance from the ministry that I think is really exciting is another point that you made is kind of broadening the scope of partners in when you're thinking of health teams. We're not talking just about patients or even clients, but just citizens, people living in the community, and broadening our scope of partnership to include things like supportive housing, volunteer associations, municipalities. Again, there's no prescription right now, but even hearing guidance from the ministry that has this bigger umbrella, I think opens up the dialogue, and that's really exciting too.
Kathy?
I would say the thing I'm most excited about is actually how the system can look at whole person outcomes. So instead of I get X amount of funding and my widgets associated with that funding are X, does that really look at the whole person outcome? I'm measuring what I'm doing, but not what everybody else is doing, and how in concert those are working together, or adversely how they're not. So I think this actually has real opportunity to to really look at the whole person and what are we actually trying to accomplish for people to live the healthiest lives possible. You know, I actually have been long saying, and it's not very popular among my colleagues, but I think there's actually plenty of money in the system. We spend a lot of money on healthcare, and if we use it efficiently and ask the right questions about what outcomes we're actually seeking here as a collective, about a whole person, I think the sky's the limit, really. So I think if we can ask those kinds of questions and measure, as I said, as a whole person outcome, I think that would be amazing.
And Karishma, before we give the audience a chance to ask the panel members some questions, you have the final word on this one.
So we're excited, actually, at the RNAO because the scope of nursing has increased. So first I'm putting on my RN hat and being on the board. And what's really exciting about this is that we've developed best practice guidelines, and it's being used internationally. So we have best practice guideline organizations in Chile and Spain, China, the US, in Canada, and actually in Ontario, a lot of organizations are now following those guidelines, and they're evidence-based. If you ever read one of them, they're very, very long, so don't read the first 30 pages, just read on after that. However, they are very, very well thought through. And what's exciting for us is that these are being actually now used, so 2 of them specifically, and one of them is actually person and family-centered care. Now, patient-centered care is not that new. It's been around since before 2006, but in 2006, the RNAO and the CNO had a statement that now we are practicing patient-centered care, and then the guidelines came out. What's exciting about this is that the teams are using these as a base or as an approach to actually create the programs. So from the RNAO's part, we actually are training people. So we just had some of the first ones trained, and pictures of them, and then we educate them as well. So that with that policy and with that guideline, you will actually learn how to give it. It's high level. It's not very specific, but it gives you guidance on how to actually create your measurements, keeping the client engaged and the patient involved in the whole process. This is about patients. Because really, ultimately, all of us, myself included, we're all clients of the system. So how do we want this to look like, sound like, and feel like for us and for our family? And that's what we're doing here, is that we're now really honing into that and saying, we want to know, what do you want? And in your area, what is the most pertinent thing that is appropriate? So this will address that, and that's lovely. The other thing that I'm excited about is what we've all talked about, integration and working together. Working in a hospital sector, sometimes even just transferring somebody, and if they needed dialysis and rehabilitation, I cannot tell you how hard it was to find a rehab spot. It was begging, borrowing, negotiations. We shouldn't be negotiating something a patient has a right to access. And I think this isn't just one example. There's a lot of examples like that. And if we actually look at what does the patient require, how can we provide that for them, that it'll be a more seamless approach versus, like you said, silos. Well, I'm just going to measure my part. I did really good, so I'm going to get the money. I don't know about you. So now we're looking at, well, how do you do things differently? Well, let's see if your approach works with our approach. Same thing within hospitals as well. So I think that will really, from my perspective, if this is going to all work out as we're planning, although it's going very fast, it will actually change the face of healthcare, which will be very exciting. I think the other thing is, from an educational perspective, because I'm also an educator, is that we teach our students this. I mean, this is one of their competencies with their college. And it's not just for us, it's also for medicine, for physiotherapy, for social work, for psychotherapists, and so on. So now we're educating our students how to step into the world and work with patients in patient-centered care. Yet, if you would actually take organizations, a lot of them, especially from being on an organizational level, there are pieces missing. It's not patient-centered. It might be, oh, it's easier this way. And so now we're taking that layer off and saying, no, we're going to actually go through the whole layers and see, does it work organization-wise and also practice-wise? but also as we're educating our new nursing students and medical students, now when they come out, they actually see it in action. They can actually do what they are taught to do, and that's really exciting.
That's great. I think that's a great segue, and you guys have given a lot to our audience to ask about. So we're going to do this just like a grade 3 classroom. If you have questions, just raise your hand, and we'll have you stand up and shout it out loud. Yeah, go ahead. And if maybe you could just say your name and your organization or where you're from.
Okay. My name is Lisa Drogo, and I'm Vice President Client Services with ALS Canada. Heather mentioned voluntary organizations, so I'm going to fit us in that context. We are responsible for providing support for 1,000 Ontarians living with ALS, and we are 100% funded by donation. Yet we're providing education and information. We're helping navigate the healthcare system. We have a long-term equipment loan program that takes over from the LINs when they no longer can provide program. We have 12 staff across the province supporting 1,000 people. How do you suggest or recommend that an organization like ours engages in the Ontario Health Team conversation? We believe in it strongly, and we believe that many of the services we're offering are an integral part of the integration, and quite frankly, we shouldn't be in the business of providing some of the services there. What advice do you have for an organization like ours?
Great question. Who wants to start?
I would say that there are other organizations too, similar to yours, that are providing really critical services for people who are whether it's disease specific or they have other health needs. And I think I don't think the intention around Ontario Health Teams is for them to be all to provide everything, but that they will be able to liaise easily with organizations such as yours and others that provide these kinds of critical services. I think the mechanism for getting involved, I think at this stage is I still think we're still at infancy time and still trying to. If we're 4 months in, we're 3 months in, we still have a long way to go. And as I think as maturity comes around, the OHTC will again be reaching out to their communities, other provincial organizations to say what can we do that will be better for integrated care for the populations that we're serving. And I think through that there will be more opportunities for the Rural Association and others to assist with that.
If I could just add, at the Alzheimer Society, Kyle actually facilitated, and you're welcome to join, a group of like-minded health charities who are in a very similar boat as you. And I think feedback that we've heard is, we provide and are funded for some frontline services, so it's not the same. But I think your situation is maybe something that wasn't anticipated.
Mm-hmm.
We're talking healthcare transformation. I think services like yours were probably like, oh, right. It was, not God. I don't think it's for you're not important, but it was kind of like, and I heard through, ministry staff saying, well, that's a really good point, and you actually provide a very specialized service for a small number of people, but a very important service. So I think, whether you want to engage at every OHT table with 12 staff, I don't think that's probably very feasible, but I would suggest coalescing with or collaborating with other like-minded organizations. I think the CSA is a great vehicle to do that. But Kyle, who's sitting right there, has gathered a group of folks together to talk about those kinds of things. And actually brain injury, where are we? Right there. Or spinal cord.
We're right here,
Yeah. Same boat. And approaching, I think you guys are approaching, and maybe you want to talk about
yeah. No, I think that's a great question that you raised, because we're in a somewhat similar position. We provide very specific type of care for high need specialized patients and our clients, and we are actually hosting an All Disability Coalition next week, and I know you're invited. So I think it will be a great conversation to really learn about how we can approach and put forward our needs in a uniform fashion. And move forward in a positive direction, because I do believe that the reform is a step in the right direction. Me and Kathy were having this conversation earlier. It's just a matter of how it's going to turn out and filling the gaps. Yeah.
Maybe PAAC could just bring together a really big event with everyone, and they can just
Yeah, that would be great.
Any other questions from the audience? Yeah, of course, go ahead.
So my name is Mike, and I'm with the Registered Nurses Association of Ontario, and I'm also an emerge nurse. And for Ontario health teams, there seems to be potential for a lot of agencies to be involved in breaking down silos, which is excellent, and that's what we need. But there's also going to be a lot of information that's traveling back and forth between these different organizations. And how can we overcome that hurdle for effective sharing of information, especially with patients and their family members, given that there's this increasing expectation amongst patients and their families that they should have access to their personal health information in more convenient manners than how it currently is. So possibilities for technology to be part of that. I'm curious as to your thoughts.
So I mean, one possibility is that there might maybe changes to the legislation to help enable information sharing. But even in the absence of changes to legislation, I mean, the expert is in the room, Bonnie Friedman is here for BLG, privacy lawyer. There is a circle of care concept, right, in the Personal Health Information Protection Act, which would allow sharing of information. And it is something that as teams are coming together, even in the initial stages, we are working into partnership and governance agreements, is an acknowledgement of those potential challenges and how they might be addressed even in the initial stages where there's information sharing.
If I may just talk on to that, I think it's quite interesting that patients and people have told us that they don't want to repeat their story. And yet as healthcare providers, we've built up some great processes for making them repeat their story. At the same time, we do have a responsibility to find a balance in terms of protecting their information. And that balance piece is the part that I think we're going to have to really work hard at. It was one of the challenges with health links in terms of information sharing, particularly with the circle of care. However, that is interpreted, and I think we're now right back there again, and we're going to need to come to terms with how that's going to operate, because our integration efforts will be thwarted by a lack of information, or again, just the ability to siphon off what people need, who needs it, and how much information is available. So it's a really important question. I think one of many that we're going to have to tackle.
If I can just add to that. The ministry is well aware through its consultation that privacy law has been a barrier, either in the way it's been interpreted or in the way it's written, because these laws were written before integrated systems were thought about, and in my opinion, do not facilitate an integration of technology or of sharing. We also need to get all the regulators on the same page. We need the ministry with the Privacy Commissioner's Office. You need to have a dialogue so that we're all interpreting the law in the same way. But I am heartened to see that the ministry has extended an invitation to a number of privacy lawyers to come and speak about the modernization of the law to address what I believe I've heard representatives of the ministry say, that in every consultation that the ministry has conducted in Ontario, they have heard that information sharing is a barrier either because people are misunderstanding what they can do under the legislation, or they're afraid because of the number of class actions that are currently being engaged in against healthcare providers in Ontario. And I think there's an educational piece for the public as well. People believe that hospitals have deep pockets, and they're prepared to engage in litigation without understanding that that's money that is going to, in one way or another, come out of the healthcare system. And you may want to put it aside, because we have to understand the risks of using electronic means of communication, and people adopt it in other areas of their life. We may want to put aside some of our personal concerns, understand the risk in order to facilitate a stronger and more sustainable healthcare system. But that's going to be a question of bringing in the courts. There are going to be court decisions that don't support this view, as well as a piece of legislation that really, in my view, needs to be updated if we are going to achieve an integration of services that requires an integration of information.
Can I just add a piece there too? It also is going to require, I agree 100%, I'm here all the time as well. But it also is going to involve capacity building within the sector, because especially around, you've got the big players, the hospitals who, for better or for worse, have it more together when it comes to medical records and sharing of information, at least within their own walls. In the community sector, that is not the case. And you've got some really small, you've got a 12-person provincial organization who's providing really critical care, but you probably don't have, I don't know, but I'm guessing you probably don't have really sophisticated, and neither do we, medical records and ways to protect that data. So I think there's going to have to be some capacity building in the sector to make sure that everyone's on the same page and can actually handle the data that comes our way should the legislation change to allow that to happen.
Maybe one last question, if anyone has one. Okay, so one last question maybe from each panelist. I'll challenge you to respond in under a minute and maybe pick one thing to focus on, which I know is not an easy feat, especially on this topic. But as we move forward on transformation, and we have representatives in the government here and many other healthcare leaders in the audience who I think would be interested to hear, if you could give one piece of advice to the government or to other healthcare organizations who are looking to undertake this change, what would it be? What should they be doing to make sure this is as successful as possible? And Deborah, thank you.
I think I've said it before, it's patient-client co-design system. It won't matter what providers want, nor with all due respect to government. It's really going to be judged in terms of its success on the basis of how patients respond to the changes in the system, how people respond to the healthcare system. So